Congratulations on taking the first step toward understanding more about your function and your knee pain. I'm Luke Kane, founder and creator of the Knee Program, and we're going to run through some really simple life applicable tests to help you understand what level of function is most suitable for you, and hopefully uncover some new information for you about your ability to control position, your strength and so forth around your knees. And now, what we find with people that suffer from knee pain is you are very, very good at working around your knee pain. To a point, obviously. If it's really bad all the time, then it tends to be overwhelming. But most of the time, you can work around your pain. The body's really good at masking it. So what we want these tests to do is to highlight any deficiencies that you might just work around in your day-to-day life. So in order to guide you as to where to go with the programming, if you want to go down the programming path, is each one of these tests will align to a specific level of function that we program our knee program to. So the first test, if you can do the first test, then you progress to the second test. If you can do the second test, you progress to the third test. And then each one of those, wherever you struggle, if you can't pass the first test, then the foundation program is going to be the best option for you. If you can do the first one but you can't do the second one, then the longevity program is going to be for you. If you can do the second and the third, then the lifestyle program is most likely going to be the best choice for you. So let's get started with the assessments and start finding out some information about your function. Alright, test number 1. Now this is super simple. What we often find though is that people's balance is a really limiting factor in their ability to get through exercises, get through their day without overstressing their knees. And now, most of the time, we stand there with 2 feet on the ground. So you don't often challenge your balance too much, except for when you're walking or changing direction or you stumble a little bit and you have to control your positioning. That's when it's amplified and that's when you're most at risk. So it's really important to know how good or not so good your balance is. Now, the simplest version of balance that we're going to go through today is a single leg balance test. Now, we're going to stand with your feet together. We're going to take 1 foot up off the floor in front of you and we're going to hold there. And you want to hold this position for 15 seconds. Ride out the 15 seconds. If you've stayed stable, happy days, and then we change the other side. 1 leg up, 15 seconds. Now, people often say, like, why do I need to be able to do that for? Like, yeah, my balance is a problem, but that's not my knees issue. Balance is really a cluster of factors. So your strength, your proprioception or your awareness in space, your vision, and your vestibular system, your inner ear. Now, if you take away the ability of any of those, say you reduce your strength, or you reduce your proprioception, your ability to position yourself in space, then your balance is going to go down. If your vision is a bit off, then your balance is going to go down unless the other things have enough capacity to uplift. So with a single leg stance, if you can't stand on 1 leg for 15 seconds without really losing position and struggling to stay up, or if you can't stand there for half a second, then you're going to be challenged when you're walking. You're going to be challenged when you have to bend down and pick something up. You're going to be challenged with so many activities in the day that require you to transition on 1 leg. And if that's the case, it's going to put a lot of stress to your knees. So if that's you, if you can't complete that 15-second balance test, then the foundation program is going to be best for you. The foundation program really focuses on building your base of strength and control. We do a lot of seated exercises. You don't have to get up and down off the floor. You can do you can do some of the lying down exercise on your bed if you like, but it's basic building of the foundation of your strength, stability, and control. Okay, test number 2. Second test, for those of you that cruise through the 15 seconds of the single leg stance, is going to be a single leg sit down. Now, it's really important that you just sit down. Now, this is going to be challenging for a lot of you. If you can't do these tests, that's perfectly fine. It's just we want to give you an idea of your function and where your function is at this point in time. If something's too uncomfortable, if you go to do it and you go, oh, that's very painful or that looks too painful for me, then don't do that test. You will be at that first level focusing on foundations. So single leg sit down. What we're going to do is you're going to take one foot off the floor. Now you can do this because you did the 15-second hold, so you're on one leg, and then from there you're going to sit down onto the chair with control on the one leg. Put both feet down, stand back up again. You can do the same thing on the left leg, one foot off the floor, sit down with control, and then stand back up again. Now, if as you sit down, the knee's twisting, or you're getting pain in your knee, or you start to do the movement and then you collapse down onto the table, you don't have control. Now, we often get asked with a test like this, why do I need to be able to do that for? It's one leg, I would never sit down on one leg. And that's true, you wouldn't often sit down on one leg. But both legs are working when you're sitting and standing. So if you have the ability to do it on one leg, then you'll have a very comfortable ability to do it on two legs. And so it's a nice indicator of where you are in your function. If you're challenged and you lose your balance a little bit and you have to control yourself down, you're going to be able to do that. So your risk of falling is less, the risk of getting into awkward twisted positions at the knee is less, because you have the strength on each side to be able to control your body weight down onto a chair. If that's you, then you are the longevity program. Level 2, if you can do this test, then you'll be good for the longevity program. If you can't do this test, or you didn't even want to initiate it, the foundation is going to be the best bet as a starting point. In the longevity program, we're going to take you from being a little bit apprehensive about this type of movement, but you can do it, up to being able to do more challenging exercises. So if you can do this test, longevity is for you, or we'll find out if you can do level 3. Okay, so level 3, the third test. Now, you only do this, or only try to do this assessment if you were able to sit down onto the chair on one leg with control. Yeah? So we've gone from the first stage, can you stand on one leg? Second level, can you sit down with control on one leg? The third level is going to be, can you sit down and stand up again on one leg? Now, this is going to be too challenging for a lot of people, and that's perfectly fine. You don't have to always be able to do all of the assessments perfectly. So if you think, I could sit down, but the idea of coming back up again, I don't know, I don't think that's for me, then that's okay. Just leave it there. Longevity program is going to be the best choice for you. So, test 3. Again, we're starting with our feet together, taking one foot off the floor. We're going to sit down with control, and then from there, without putting your hands down, we're going to stand back up again with control. Now, we want you to be balanced at the top of the movement when you finish. If you sit down and you go to stand up and you're wobbling around and you put your foot down before you stand, that's not a controlled movement. Okay, so we want nice control, down and back up again. And we're going to do the same with the other leg. Feet together, one foot off the floor, sit down with control, stand up with control, and back down. So you can see these really simple tests stack on top of each other. Start off with the balance. If you can balance, then can you sit down on one leg? If you can sit down on one leg, can you stand up on one leg? So just like with our single leg sit down, our test number 2, in test number 3, people ask us all the time, why would I need to be able to sit down and stand back up on one leg? I would never do that. I always use 2 legs to sit down and stand back up again. And that's perfectly reasonable. However, it's a matter of relative strength. If you have the capacity to do it on one leg, then you have the capacity to do it on 2 legs very easily. If you have the capacity to sit down and stand up on one leg, then you have the strength through a good range of motion to be able to control and absorb force, to be able to control and absorb your body weight. So if you were to stumble on a step and have to catch yourself in a deeper position, you could do that without putting too much additional stress on your knees. If you had to do anything dynamic like jump or run or run for a bus, then you could do that without having too much stress on your knees, because you have the strength around your lower limb to do that well with good knee control. So it's about the ability to do it on one leg, sit down, stand back up, is about what that means for your overall strength left and right, and how that works into every other part of your life. So if you can do this test, that's fantastic. Even if there's a little bit of irritation or a bit of soreness there, my left knee, I have a bit of arthritis in my left knee, so sitting down, standing back up is a little more challenging in my left than my right. I feel it a little bit. It's okay. I can do it, which means I can challenge myself with other exercises and other activities. So if you can do those, the lifestyle program is going to be for you. If you're not sure, if you're kind of on the fence, you're like, I could sit down and I started to stand back up, but I didn't do it very easily. My knee buckled a little bit when I did it, or it felt a bit uncomfortable. Start low. Go for the longevity program, build up your resilience, build up your strength and control, and then move into the lifestyle program later. The important part is for you to understand where your limitations are. Are you limited by your balance? Are you limited by your control in a single leg movement, or are you limited by your strengths in a single leg movement? If you understand those, then it's much easier to pick and choose exercises that are most appropriate for you, or direct yourself into the appropriate program that we offer for you, which would be Foundations is level 1, Longevity is level 2, and Lifestyle is level 3. You're pretty happy with what you found out in the sit-to-stand testing or the balance testing, then please, we would love to see you join us in our online knee programs. We've taken the best information that we have from seeing thousands of people in clinic across Sydney and helping them achieve their goals and get to living the life they want to live on their terms with arthritic knees. We've taken that information and we've put it into a simple to follow 12-week program structure that is broken into 3 different levels. The first level is Foundations. So if you struggled to balance on level 1, or you couldn't sit down on the one leg, then with control, then Foundations is going to be the best bet for you. If you could sit down with control but you couldn't sit and stand, then Longevity is going to be great. If you could sit and stand on one leg, then Lifestyle is going to be the best option for you. We would love to see you join us in our online community. We engage with you face-to-face through our online portal, and we get as much feedback as we can from you along the way. You also get all the exercise equipment that you need to be able to complete the exercises at home. So it's a really, really comprehensive online process, and we would love to see you as part of that group. So if you'd like to find out more about your specific function, you found the tests useful, but you feel like you need a little bit more information, or you would like to have a more expert consultation to go a bit deeper into what you need to be doing specific for your circumstances, then please book a discovery call with one of our knee experts at MTP, and they'll be able to talk to you for no charge, for free, and put together a bit of a plan based on your particular circumstances and help navigate which direction is going to be best for you within the services that we offer. So if you really want a bit more information about your knee function and a bespoke program structure for you, then please book a discovery call and we will chat to you then.